Bismillahirrahmanirrahim. Which carotid stent for which lesion? The stent ideology have started by one stent that fits all, like Palmaz stent. Now we have a stent per each site, like carotid and renal. Now we also have moved into different stent per single site. And regarding the available carotid stent, we don't have balloon expandable stent in carotid because they are crushable. We have only self-expandable stent, which can be either braided mesh or Nitinol, which can be open cell design or closed cell design, or combination of open and closed cell design, like the new Cristallo stent. Braided mesh wire stent are super alloy, and it is braided in different diameter. It has a spring-like expansion, and a good example is the Carotid Wallstent, which you can see by Boston Scientific, and it has very good radial force. And regarding the Nitinol stent, it is laser cut Nitinol of Nitinol tubes. It has crown and bridges. It expands by thermal affection, and it can be expanded to the optimal diameter, so it has a thermal memory. And this is one of the example of Nitinol self-expandable stents. Now the Nitinol stent can be, as we have said, a closed cell design or open cell design, and each part of the stent will behave like a separate stent. Here you can see magnification of a smart stent by Cordis, and you can see how it is connected to each other. Now you can have either in the open cell design either peak to peak or peak to valley. These are the famous three example of peak to peak, which by Bart, and precise by Cordis, and optimate by Sinus. And you also can have peak to valley like the silver stent. And remember, now we have drug-eluting stent, which is silver by Cook, called silver PTX, and we are very interested in the silver PTX trial. And we also have Acculink by Guidant, which again peak to valley. Now the closed cell design, it has better lesion scaffolding, it has less struts distortion, it has excellent radial force, and as you can see from this shape, this is a good example by the exact stent of closed cell design, and also the next stent is a closed cell design made out of Nitinol. Now each lesion characteristic will demand from you to select a type of stent that matches. If you get tortuous vessel, you need a stent with better vessel comfortability. If in thrombotic, you need a good lesion coverage by covered stent. In difficult access, you would like to have better deliverability. In long lesion, you need exact positioning like Carotid Wallstent. If diameter change, you need vessel adaptation like open cell design of self-expandable Nitinol stents. In fibrotic lesion, you'd like to have good radial force, and in tight lesion, you need a really good profile. So these are the two steps you have to select, either mesh wire or Nitinol stent. And regarding vessel tortuosity, you have to remember that Nitinol stent will follow the curves of your stent. For example, here you can see that the mesh wire stent in tortuous vessel will shift the kink distally. You can see now the distal kink was being shifted up. If you have more curve, this can be a problem. But if you put Nitinol stent like a smart stent in this patient, you will have better adaptability to the shape, and you will have a nice curve. Then you will get this picture, and without a distal kink to it. So it is safer when you have more tortuosity to use self-expandable Nitinol stent. If you can imagine that you have one patient, which is the top two pictures, and for one of them you have put Nitinol stent, and for the other one you have put mesh wire stent. In Nitinol stent, it will have a smooth curve, and you will get a curved stent. In case of second picture on the right side, you will have a straightening of the vessel, and the kink will shift more distally. And if you get a plain X-ray, you see the stent in upright position, doesn't curve. Again, if you're looking for better scaffolding, like this nasty looking lesion with ulcer crater and maybe fresh thrombi, you're looking for a vital characteristic of your stent, which is lesion coverage and good scaffolding, which happen by mesh wire stent. And then you can get such a picture if you put a mesh wire, and the other picture if you put Nitinol stent. Again, if you have difficult access like octogenarian and type 4 aortic arch, then you're looking for better deliverability of your stent in order to reach a good position and to be secure in stent deployment. Long lesion like this one, again you want to put the lesion that can cover the whole length and have good tensile stent like Carotid Wallstent, and always be very careful with the distal kink, especially when using such a long lesion like this case, where you can solve it by either putting another stent or balloon dilatation, or just observe the patients. Again, you have to remember there is no foreshortening in Nitinol stent, and sometimes you get distal flaring which is very nice in cases of disparity between common and internal carotid. Again, in mesh wire you have to remember there is point of no return, which means you can deploy up to 50% of the stent. If you're not happy about the position, you can retake the stent back in again and reposition it if you didn't cross the point of no return, which is 50% length of the stent. High grade stenotic lesion like this one, again you need a better crossing profile. If not, you use pre-dilatation to 3 mm balloon, and obviously better to have proximal protection because this type you are not protected. Different vessel diameter, again you get a lot of discrepancy between vessel diameter and here Nitinol is have an advantage of expanding to 7 mm in common carotid while only expand to 4 mm internal carotid. Again, comfortability, which is better in Nitinol stent compared to mesh wire stent, and this is an example of a carotid case done by Nitinol. Taper stent was a good idea in the beginning, but in clinical practice is very difficult to match the patient anatomy by conical shape, and this is an example of tapered stent. Again, next stent, which has a closed cell design and distal flare on each side, is a self-expandable Nitinol stent, and it has very good scaffolding, lesion scaffolding. Now I put here as a conclusion of this lecture the lesion type and if it is better with Nitinol or better with mesh wire. Remember, if you have tortuous vessel, you're better off with Nitinol. If you have long lesion, you're better with mesh wire. If the diameter is changed, you are better with Nitinol. My personal feeling regarding this issue, I've put it here. You get more adaptability with Nitinol stent, and again a smoother angiographic picture by Carotid Wallstent, and you get exact positioning in Carotid Wallstent and repositioning. And now both systems are a monorail system, but it is easier with Carotid Wallstent monorail system, and you get higher radial force with Nitinol stent. So my conclusion is, in your case, when you book the patient for carotid stenting, it is better to have both system available, mesh wire and Nitinol, and this is safer for the patient. Thank you very much.